Hi guys, so follow up on the video that we did last week, which was on cardiac arrest or chest pain in particular. And we talked about the blocking of a vessel and then you developing chest pain and about how important it was for you to get to hospital. Well, just as a follow on from that, what happens if the same blockage of an artery that we were talking about in the heart, what happens if that happens in the head? And this is called a stroke. Now, stroke can be broken down into a couple of different kind of types. So you can have a hemorrhagic stroke where you have a bleed in the head. You can have an embolist where you get a blockage that's traveled maybe from some other part of the body, particularly after maybe a hip or a knee surgery or whatever, or a long flight. And then you can have a kind of ischemic strokes, which are blockages within an artery which stop kind of oxygen getting beyond the blockage to a part of your brain, and then you have the stroke. So there was we kind of run, or the health authorities in the UK and in Ireland ran a series of events, and they rolled out a series of ads that talked about the concept of FAST, or how to identify a stroke. And it was FAST. So the first one was FACE, and you have to physically do these things. So when you're checking a patient, so you ask the patient to make a big smile, and if they can't, if their face is dropped, well then that's the sign of a stroke. Alternatively, or in addition, you can get them to stick out their tongue or blow out their cheeks. And if there's a droop in the tongue or one side of the cheeks don't blow out, that's shown some type of facial paralysis or facial droop, and it's the sign of a stroke. And that's it. That's a stroke that we're having, and it's time to call 999 112 and get the patient transported to the ambulance. If you're unsure about that, the next one is arms. So you ask the patient to close their eyes and raise their arms out in front of them and hold them there, and they should be rock solid. So you can have a full stroke where you've got complete droop or complete paralysis, or you may have a person that is having a problem just holding them still, signs of a stroke again. If you're unsure about that, then you move to speech and you check, is the patient's speech slurred, or are they able to pronounce back to you a series of words. So today I'm in work and I'm doing a first aid course. So they should be able to pronounce that back to you fairly simply and without any confusion in the words. If that can't happen, or they've slurred speech, again, signs of a stroke. And then the last one is T, and T stands for time. So obviously a time to call the ambulance or the emergency services, and also if you can note the time that when the stroke happened. And the reasons behind this is it's so important that we get the patient to an acute care facility or a stroke hospital or a head hospital within 4 hours. And that 4 hours includes the time to MRI, do scans of the patient's head and administer the medication. That all has to happen within 4 hours. So as quick as we can get them to hospital, the better. Now the problem that we have is when the ads were run, people are expecting to see people with face droop or paralysis on one side of the body, and that doesn't always happen. And that has caused people to delay in calling the ambulance because they didn't tie together the symptoms and the signs that they were looking at and what was actually happening with the patient. So they thought a stroke it didn't look like it looked like on the television, or that's not what I was expecting, and we wanted to see would it go away. So there has been some confusion as to what the FAST was, what exactly FAST was, and what exactly a stroke looked like. So a stroke can be just like dizziness. It can be confusion. You might not have facial droop. You may have blurred eyes. You may have dizziness when you stand up. There might not be the full set of symptoms that you would expect to see according to the advertisements that you saw on the TV. So always err on the side of caution. There's a list or a scale for consciousness called AVPU, or alert, verbal, pain and unresponsive. So alert being as you are now listening to this video. A verbal would be when I have to come in and kind of call your name or give you a little bit of a shake to rouse you up. And I generally do a fast assessment if I find a patient in a level of consciousness that is around a V. And then the third one is a pain response. So if you've no conscious verbal response from the patient, you apply some pain, maybe pinch the back of their hand or their earlobe, and see if you get any kind of a flickering in the eye or a pain response. And then the last one is unresponsive. So strokes can also occur where you have what's called a TIA, or a transient ischemic attack, and this is where you have what's called a mini stroke, and it can go within an hour, but it can last up to 24 hours, and then it dissipates and you have full functioning again. But it's a precursor, it's a warning that, you know, going forward in the future, there's a chance that you're going to have a full-blown stroke. So if that's the case, or you've had, you know, when your granny or mother comes home and said, you know, someone had a torn in the shopping centre, or a torn in the shops, that generally is a TIA, and you should go and get that checked out then and have further medical intervention. But do not delay. When you suspect a stroke, you have to call the ambulance and get the patient to the hospital, because there is drugs that can be given that will reverse a lot of the clotting process in the head, and can sometimes give full functionality back, but it can certainly give a lot of functionality back depending on the time that the person has been starved of oxygen. So it's really important to get the person to the hospital. Okay, that's it guys, thanks for that, bye bye.